Welcome everyone to this afternoon's session of Solid Finances. Before we get started, just a few little housekeeping items. Thanking our sponsors for this year. We've got Montana State University Extension, University of Idaho Extension, NDSU Extension, and K-State Research and Extension. A reminder that our website does have all of our past recordings. It has the upcoming schedule, contact information for everyone who helps to design this series for the year. And so if you have any questions or comments for us or need to get in contact with one of the presenters, we can provide you with that information. And then also every one of these sessions that we host, we do have a resource sheet that should have some information and links to some resources that we talk about here in the session. Some interactive tools today. We ask that you kind of be a little more interactive with us, and we've got some poll questions for you. These are anonymous. Nobody will know what you answered. Same with our Q&A pod at the bottom of your screen. You can type in a question. Again, these are anonymous. Nobody else will see them but us as hosts, and we will not give away names. So we'll just say a question has come in. So please feel free to ask questions of our presenters. Upcoming sessions next week, I will be presenting a slasher spending session, so talking about how to cut expenses from your budget. And then on November 1st, so we've got a little bit of a time off, we've got Budgeting for Your Good Life from Elizabeth Kish at K-State. Today we have Deborah Woods from K-State Research and Extension. She is in the Central Kansas District. She's a family resource management agent for Kansas State Extension Service. And she is also a certified SHIC counselor. And as she goes through her presentation today on Medicare, you'll learn what that means. Deb has done many presentations on Medicare, and she's kind of an expert in this field, so I'm very happy to have her with us today. And I am going to go ahead and let you take over, Deb. Thank you.
Okay, thank you, Carrie, and thank you for asking me to share with your audience today. K-State Research and Extension has partnered here in Kansas with the Kansas Department on Aging and Disability Services. We did this to be able to provide Medicare education and assistance throughout the state, so that we can reach more people, basically. And it's part of the Senior Health Insurance Assistance Program, which is a nationwide program. In Kansas, we call it the SHIC program, for Senior Health Insurance Counseling for Kansas. But I wanted to point out that these services are available in every state. It may be called something different, but you should have that service available to you locally. And on the resource sheet that Carrie mentioned earlier on the Solid Finances website, I have some information there on how you can find assistance or how you can locate a SHIP counselor near you. And I've also tried to give some additional information so that you're not frantically trying to write down everything that's on the slides, and you have some resources to refer back to later. So basically, every day about 10,000 baby boomers turn 65, and with that come a lot of decisions about Medicare, which can be confusing. To be honest, the answer to many Medicare questions is it depends. So I'm going to try to cover some of the basics of Medicare, including enrollment periods, cost, coverage, some options that you might want to consider. But it's always a good idea to seek out the advice of an expert if you have a situation that you really have questions about, just to make sure that you're getting good advice and good information, because Medicare can be complex. One other thing about the Senior Health Insurance Assistance programs is that they're free, and the information is unbiased. Anybody who's a SHIC counselor will not be trying to sell you anything. Another thing that I wanted to point out as we get started is that everything I speak about today will be the law as we know it today. And of course, it's all subject to change if they pass legislation back in Washington that changes the program. First thing I want to do is to try to get an idea of who is out there. So Carrie, if you could put up the first poll so that I could get an idea of where you live. And if you can just select the little button there. And I don't know how we tell whether if most people have answered yet or
Yeah,
not.
most people have answered. I went ahead and broadcasted the results so you everybody can see them.
Okay. Okay, so most from North Dakota, Montana, a few from North Dakota, South Dakota, and then others. And I'm not sure if anybody has responded to where
Have somebody
that
from
is in
Arkansas.
or not. Okay. Okay. Well, I'm going to try not to speak about anything that's really state specific. So, but if you have any questions, just let me know. Next question would be about how you get your current health insurance if you are insured. So far everybody has an employer plan.
Yep, that's what it looks like.
Okay, okay. That's good to know. And then whenever you're ready to broadcast and go to the next, okay. And then the last one, get a feel for how close you might be to retirement.
Okay, it looks like we do have most of them answered.
Okay, so about half or 5 or more years from retirement, the other, maybe one that's already retired and the rest that are getting close. So I find often when I do these programs that I have people who will come to them, and they may come to them multiple times, you know, as they want to get some information as they're starting to think about it, and then as they get closer, you know, come back and find out has anything changed. One of the reasons that Medicare is confusing is that there's several differences between it and what most people are used to with their employer coverage. One of the first things you might note when you get into the Medicare world is that there is no we in Medicare. So where you might be used to having coverage for your spouse, for your family under one policy that includes health and drugs, when you become Medicare eligible, each of a couple, each individual is going to have to enroll separately in Medicare. So they'll have to enroll in A and B. They may want to pick up a supplement plan or choose Medicare Advantage. They'll want to pick up a drug plan. So each of those decisions is going to be separate. There will also be separate payments for that. One thing to keep in mind is that you do not have to be enrolled in the same drug plan as your spouse. You do not have to be enrolled in the same supplement plan as your spouse. You can even, one of you be in original Medicare and one in Medicare Advantage. So they are individual, and you can be enrolled in them individually depending on what your health status is and what your needs are. So there are 4 parts to Medicare. Original Medicare was passed in 1965, and it consists of Part A and Part B. Part A is your hospitalization insurance, and it's going to pay when you're actually admitted to the hospital. Part B covers pretty much everything else. I tell people it's going to be your outpatient services, doctor's office visits, preventive care, medical care outside of the hospital. Part D is your Medicare prescription drug coverage, and that was added just 11 years ago, actually, in 2006. And then Part C is what are known as Medicare Advantage plans, and what they do is they combine your health care and often your drug coverage all in one plan. So they're going to look more like an employer plan. They're going to be delivered totally by private insurance. So you've turned your coverage over to that private insurance company rather than the government, paying the bills, basically. There are, however, items that are not covered by Medicare. Many people think that everything's going to be covered, and this is just kind of a partial list of some things that are not covered. You're going to see, routine eye exams, routine dental exams, dentures, prescription glasses, hearing aids, exams to fit them, long-term care or custodial care. So you'll notice on this list there are a lot of things that we need as we get older that are not going to be covered by Medicare. So that's one thing to keep in mind if you're thinking about budgeting for health care in retirement. Another thing to note is that for Medicare to cover medical expenses, not only does it need to be something covered by Medicare and medically necessary, but the beneficiary also must go to a provider that takes Medicare. So if you go to a provider that doesn't take Medicare, you're paying 100% of that cost. Medicare is not going to be covering it. Or in the case of a Medicare Advantage plan, if you've chosen to go that route, the provider needs to be in the PPO or the HMO network of the plan that you choose. So next thing that we want to do here is I'd like to put up another poll and get an idea of how familiar you are with when you should enroll in Medicare. Okay, so, and I can't tell, Carrie, if when you broadcast results, so I don't know whether that...
I have broadcast
closed. Okay. Okay, so as far as when you enroll in Medicare, the full retirement age for drawing Social Security benefits has been increasing. It's increasing from age 65 to 67. But one thing they didn't do was to also increase that Medicare eligibility age. So unless an individual is disabled, the first opportunity they're going to have to enroll in Medicare is at age 65. Technically, though, when you should enroll depends on whether or not you or a spouse are covered with employer group health coverage. And so really I would take either 65 or full, it depends as an answer I would say would be correct on that. I want to talk a little bit about enrollment periods. So some key dates for Medicare as you look forward, or look ahead to that. The initial enrollment period for all parts of Medicare, so A, B, D, and C, is the 7 months surrounding when you turn 65. That's going to include the 3 months before the month of your birth, and the 3 months after. If you don't enroll during this time period and you don't qualify for a special enrollment period to enroll later, you may be subject to a late enrollment penalty. Now, Part D and Part C also have some additional enrollment periods. Every fall from October 15th through December 7th is an open enrollment period, and it's a period of time that anyone enrolled in a plan can make changes for the upcoming year, but it's also a time that anybody who's not enrolled can do so for the first time. As far as the drug coverage goes, if you enroll for the first time and you've not had creditable coverage, you may face a penalty. Then for the Medicare Advantage plan, there's also what's called a disenrollment period. It's a time of year every spring when beneficiaries can disenroll and go back to original Medicare. So those are kind of some key dates to keep in mind as far as enrollment goes. I want to take a look here at when coverage is going to begin when you enroll, because for those who enroll prior to when they turn 65, that coverage is going to begin the first of the month. It doesn't matter when during that month your birthday is. If you wait and then you enroll the month of your birthday, it's going to begin the first of the following month. But if you wait to enroll in those 3 months after you turn 65, technically you can enroll them, but there's going to be a little bit of a delay in your coverage. So you want to keep that in mind so that you don't end up with a gap. For example, if you enroll 3 months after you turn 65, your coverage is not going to begin for another 3 months. Also, if you've missed that initial enrollment period and you don't qualify for a special enrollment period, you'll have to wait for what's called a general enrollment period to sign up. That takes place from January 1 to March 31 every year. If you enroll in the general enrollment period, your coverage is not going to begin until July 1, and you're going to be subject to a penalty for not being enrolled, and that's a penalty you're going to pay for the rest of your life. Basically, it's going to be 10% per year that you were not enrolled in B. Now, let's take a look at how to enroll in Medicare. Medicare is actually administered by the Centers for Medicare and Medicare Services, or CMS, but enrollment is done through the Social Security Administration for most people, those who are railroad retirees, and that's not a question I asked to know if we have anybody on, I guess, but the Railroad Retirement Board is responsible for enrolling railroad retirees in Medicare. So if you're receiving those retirement benefits already from Social Security or the Railroad Retirement Board, your enrollment in Medicare is going to be automatic. You're going to receive that card in the mail until about 3.5 months before your 65th birthday. But if you're not receiving your retirement benefits already, it's not automatic. So you're going to need to actually sign up for Medicare. You can do that by contacting Social Security about 3 months before you turn 65. You'll be in your initial enrollment period during that time. If you worked for the railroad, it would be the Railroad Retirement Board that you contact rather than Social Security. I've found really the easiest way to sign up is to go online to the Social Security website. It takes about 5 minutes to do this. You also can make an appointment to visit a local office or sign up with them over the phone, but I know our office here in my community, they get very busy, and sometimes it takes 6 or 8 weeks to get in to see them. So if you've got access to the computer and you're comfortable using it, that's really about the easiest way to do that. Okay, so we've talked about enrollment periods. I think I'd like to shift now to talk some about coverage and costs. So if we can put the next couple polls up here. So the first question is true or false, is Medicare is free?
Okay, kind of looks like voting has slowed down here.
Most people have said false. And the next poll then would be Medicare covers all of my health expenses. And that's also a true or false.
Okay, looks like everybody chose false.
Everybody's responded and everybody's chose false. Okay, which is good. Often I'll have people come in to see me and they think that Medicare's free. They're not expecting to have to pay a premium. Or maybe they know that there's a premium, but they don't think there's going to be any deductibles or coinsurance. And I'm not quite certain where they get that idea, but that's sometimes maybe a myth that they believe. So the first thing I want to talk about here when we're talking about cost and coverage is Medicare Part A. So that's your hospitalization coverage. And for most people, there is no premium for Part A. So I guess that it's free comment, for Part A, that would be true for most people. If you've worked 40 quarters, so basically 10 years, then your Medicare taxes that you've paid into the system cover the premiums for Part A. And for that reason, we typically recommend that people sign up for Part A when they first become eligible during that initial enrollment period, even if they're going to continue to work, because it's not going to cost them anything. They're just going to have that extra level of protection if they're hospitalized.
Deb, are you still there? Sorry about this, everybody. Let's go ahead and get Deb back on here, and we'll kind of go through. So I do know a little bit about Medicare, so let's kind of keep it rolling so we don't miss anything. Well, it looks like Deb needs to get logged back in. All right, so we were talking about Medicare Part A. Again, this is hospital insurance. So the first 1 to 60 days that you are hospitalized, you'll pay $1,316. And then every day between 61 and 90, you'll pay $329 per day as a copayment, and then 91 to 150, $658, and then more than 150 days, all costs. Okay. Medicare Part B, as in boys. So this, like Deb was saying, is kind of that, it's everything else. So you get sick and have to go to the doctor, you have some lab tests run, those types of things. Medicare B is what will pay for that. In 2017, these are the numbers. So for a deductible every month, you pay $183, or I'm sorry, not deduction. You have a $183 deductible and a 20% coinsurance for your doctor's services and outpatient care. Now, your monthly premium is going to depend on how much your annual or how much your income is. So if your adjusted gross income for if you're single is $85,000 or less, your monthly premium is going to be $134. And as you can see in the chart, it does increase depending on what your income is. Now, for a married couple, so joint filer adjusted gross income, you can see that's $170,000 or less. The majority of people do fall in that lowest bracket. Not everybody, but I would say the majority of individuals do. So a lot of times you'll see, oh, your monthly premium for your Medicare is $134, and that is why. But if you have a larger income, you will be paying a little bit more. Okay. I see Deb is logging back in. We'll get her. I don't want to go too far ahead and get her off of her schedule or off of her talk here either. So,
Can you hear me?
I can hear you just fine. Go right ahead, Deb.
Okay. I have no idea what happened. All of a sudden, like the building lost internet connection, but I'm back. So I'm sorry about that. And I don't know what all I missed, but this slide is about...
people asking. Yep, we have people asking to go back to the previous slide. So if you want to finish what you were.
Okay, let me get back to that slide here. Okay. Oh, I was just starting to say that one of the things that's different about Medicare in relation to like your employer coverage is that for a benefit period for Part A it does not begin until you are admitted to the hospital, and it ends once you've been out for 60 consecutive days. So you can have multiple benefit periods in a calendar year. So that's something a little different that most people aren't going to be used to. If you're, you have rotten timing and you end up in the hospital multiple times and you've always got 60 days in between, you can see that 13, 16 several times. Other things that are covered under Part A: skilled nursing care following a hospital stay if you've been admitted to the hospital at least 3 midnights, and then home health and hospice is also part of that coverage. The Medicare Part B is more similar to what you'd be used to. It's got the $183 deductible. Once you've met that deductible, Medicare pays 80%, the beneficiary or their supplement plan pays the extra 20%. The cost on this, and I came in, I could hear Carrie talking about some of this, it's $134 for the vast majority of people out there. About 5% of the population is subject to what we call the income-related monthly adjustment amount. It's basically for higher earners. And I just threw this in, and there is more detail in the handouts that you have access to on the website, just because I know sometimes I do work with people who fit into this. And next year, these amounts are changing. So at the $160,000 level for individuals and the $320,000 level for married filing jointly, they're going to be at that top level, which this year's premium is $428, and that's per person. So just threw that in because, like I say, sometimes I do run into people and that affects them. To come up with the income, right now, CMS is taking a look at the most recent tax return. So that's going to be 2016 tax returns to determine whether or not you're subject to IRMA for 2018. One thing to make sure people realize, if you are subject to it, looking at this, you think, well, I'm making more than that now, and it's because you're working and your income's higher. Once you're retired, your income is going to be lower. There is an appeals process to go through to get that taken away, so to speak, and I have had people who have done that and been successful. So I think the process does work. Next up, we're going to talk about prescription drug coverage. And basically, whether or not you need to enroll in a drug plan is going to depend on whether or not you have creditable drug coverage from another source. So creditable coverage means, do you have a plan that's determined to be at least as good as Medicare prescription drug coverage? You may have, if you're continuing to work, or your spouse is, it may be that coverage that you have from your employer is creditable and you don't need to pick up another drug plan. Other examples would be, federal retirees who have federal employee health benefits, military retirees who have TRICARE, veterans who get their medications through the VA. Those type of situations, there's no need to enroll in a separate standalone drug Medicare Part D plan because you've got drug coverage through those options. As I said, most but not all employer plans are creditable. So if you're planning to work beyond 65, I would suggest you go to your HR and you find out, has Medicare determined that this coverage is creditable? Because that way you'll know, am I okay? I'm going to be able to enroll later and I'm not going to have to worry about a penalty. Often we will suggest to people, if you're not taking any medications at all, that you enroll in the cheapest plan just so that you do avoid having a penalty in the future. The penalty it's added, it's for not being covered with creditable coverage or enrolled in another Part D plan, and it's an amount that's paid in addition to the premium amount. For somebody who turned 65 back in 2006 when drug coverage began and they've never enrolled, if they want to enroll this fall for coverage next year, they're going to pay an extra $48 a month on top of their Part D premium to have that drug coverage. So some people will go ahead and enroll and pay along so they have coverage and don't need to worry about that premium in the future. If you're subject to IRMA for Part B, you're going to be subject for Part D. So this just explains how much more you'll be paying in addition to that premium that you're enrolled in. And so again, this is in your handouts. I'm not going to spend a lot of time on it. Just want you to be aware that is something, so it's not a surprise, I guess you would say. Enrolling in Part D, to be able to enroll in a drug plan, any SHIP counselor can help you with that. You can go online yourself. If you're comfortable using computers, it's not really rocket science. Once you get things figured out, Medicare.gov, go to the plan finder, enter your medications, and you can take a look at the plans that are out there in your area. You can call 1-800-MEDICARE, call the plan, enroll on the plan's website. So there are a lot of different options as far as enrolling in a Part D plan. Things to look at or consider when you're looking at them. Some people just look, some of these plans advertise very heavily this time of year. However, the plan that's got the cheapest premium isn't always your best option. So other things that you need to take a look at, are your medications covered by the plan? What is the deductible if there is one? What kind of coinsurance or copays are you going to be paying? Is there coverage in the gap or in the donut hole? Are there restrictions? Some plans have limits on how many pills you can get per month. Some will have step therapy. They're going to make you try another drug before they'll cover your medication, or prior authorization. So these hoops to jump through. And sometimes it may be better for you to pay for a plan that's got a little bit higher premium that has better coverage. Open enrollment period, again, it's October 15th through December 7th. I suggest people take a look at this every year, whether you do it on your own or if you do it by going to a SHIP counselor or somebody else for assistance, just because these plans do make changes every year, and you want to make sure that you're enrolled in the best option for next year for yourself. And maybe your situation has changed. Maybe you're taking different medications than you were last year. So you want to make sure that your plan is going to be covering everything. I know I hate it when I get somebody in January and they've gone to fill their meds and they found out they're not covered. So there's nothing that we can do about it at that point. So I want to talk too just a little bit about, for those who are low, we talked about the high income and the extra amount that you pay. There's help available for those who are low income. And again, these amounts are in the handouts that I've got available in the resource list for you. But for an individual, for a single person earning $1,508 per month, and that's this year's guidelines, or a married couple earning $2,030 a month, if they meet both those income guidelines and the asset guidelines listed here, they may qualify for some help. That amount is your full Social Security benefit before the Part D premium would be taken out. It's going to include income from all sources. As far as the assets go, they do not count the home that you live on and the ground that it's on. They don't count one vehicle. They don't count, your personal possessions, your clothing, your household furnishings, that sort of thing. And we usually suggest, if you're close to that amount, go ahead and apply, because there may be some income that you're counting that's not counted in the calculation by Social Security. So that's always a good thing to go ahead and take a look at. There's also a program called the Medicare Savings Program that will help with Part B premiums and potentially the copays and deductibles for Part A and B if the beneficiary meets the income and asset requirements for it. It's much stricter than for what's this program that's called the Extra Help Program. And so a SHIP counselor would be able to guide you in your state on what those guidelines are, income and asset guidelines, and how to go about applying.
Well, you go through to the next slide, Deb. We do just have a quick question on where is the list, the resources, I'm assuming is what they're asking. It is on the Solid Finances website. There should be a resource link on the description of this session. So, oh, no, the list is just talking
and there
about,
are
actually, this person's wondering the list in the resources here that you were just talking about.
Oh, where in the resource list? It would be, and we were talking about the low-income subsidies, and that is on about page 1, 2, 3, 4, 5, 6, about page 7 is where that that information is. I don't know if that answers the question or not.
Yep, they said they would look for it. Otherwise, please just feel free to email myself or Joel as well if you can't find it, and we will make sure that we pointed out exactly what you're looking for. Okay, yeah. Sorry.
Yeah, that's okay. That's okay. Okay, so we've talked about original Medicare, so that covers your basic health and healthcare needs. We've talked about prescription drug coverage. Another thing that people may want to consider that enroll in Medicare, original Medicare, Part A and B, is a Medicare supplement plan. It's a secondary insurance. They're sold by private insurance companies, although they're governed by state and federal laws. The reason I feel that they're important is that Medicare does not have an out-of-pocket max like your current insurance does. And so if you have there's a lot of things that are done as an outpatient anymore that can be very expensive. Cancer treatments, outpatient surgeries, that 20%, there is no cap on that 20%. So looking at Medicare supplement insurance, what are also known as Medigap plans, can help to stop that cap or help control your out-of-pocket costs. There are 10 standardized plans by law. Again, we're talking individual plans, so it's an individual premium for both of the couple. So it is an additional expense, but often it may end up saving you a lot of money if you were to have something catastrophic happen to you. It's one thing, I guess, to make sure people are aware of in covering these gaps. These supplement plans are only going to pay secondary. They're going to pay after Medicare has paid first. So if it's something that's not covered by Medicare, so an example I given earlier was just a routine eye exam. Medicare does not cover that. Your supplement plan is not going to come in and pay that expense. It's only going to pay those deductibles and those copays after Medicare has paid. You do have to be enrolled in both Part A and Part B to enroll in a supplement plan. And the best time to buy a supplement plan is going to be during that open enrollment period, which begins when you enroll in Part B. So for most people, that's going to be when you turn 65, that initial enrollment period. But for others, if you're continuing to work, you can delay that. You're going to have a guaranteed issue period when you enroll in Part B, when you lose that employer coverage. At that point in time, insurance companies cannot refuse to sell you a policy. They cannot charge you more. They can impose a waiting period for pre-existing conditions, although the supplement plan starts when you enroll, but they can impose a waiting period for pre-existing conditions. So that's something, if that's a concern for someone, I would be sure to ask, do you have a waiting period or not when they're choosing one of these plans. Supplement plans have to be purchased from a licensed insurance agent. It's something that a SHIP counselor is not going to be able. We can sit down and explain to you how each one covers and how they interact with Medicare and help you understand that and give you an idea of what prices might be so that you're an informed consumer when you go out to purchase one, but you will have to purchase from a licensed insurance person then. This is another one of the things that is included in that resource packet. I know it's probably not very big for you on the screen to be able to see, but basically what this is showing is all of those deductibles and copays for Medicare Part A and for Part B. Down the left-hand side, the 10 standardized plans by law across the top. And then there's a check mark in each of the boxes if that plan covers that expense. So, for example, you'll see a Plan F is a supplement plan that covers absolutely everything. You pay the monthly premium, you don't pay anything at point of service when you need to go for that medical care, as long as it's something that is covered by Medicare and you go to a Medicare provider. The only difference between an F and a G is that with a G, you're paying that $183 Part B deductible. So that's kind of how to read this chart and how to go through and think about things. I would encourage you to think not only, I'm in great health now, but think long term. Do you have a family history of any conditions that you expect to need medical care? Another thing to mention would be that there was a law passed in 2015 that is going to basically cut out the plan of the C and the F starting January 1 of 2020. So people who are enrolled in those plans will be grandfathered in, can stay in them, but they will disappear from this chart as far as options for you starting at that point. So something to be aware of there, that will be eliminated. They basically eliminated plans that covered the Part B deductible. And those are the only two you can tell by the checkbox that do cover that. In some areas, there are plans that are called select plans that have a lower premium. We don't have them available in my area, but I know there are some areas in Kansas that do, and I'm sure there's some in larger, around larger cities where you live, there may be also. So that might be something to check into. Basically, not only do you look for providers that take Medicare, but you also look for, preferred providers of whatever supplement plan you're enrolling in, and you can get a cheaper premium, cheaper price for that. So one thing, other thing before I move on to this slide to note is that every company who sells, I'll use F as an example again, every company who sells a Plan F, they all cover exactly the same thing. Every company who sells a Plan N, they all cover exactly the same thing. So you truly can compare apples to apples when you're looking at these supplement plans, and really the only difference is going to be the premium, the stability of the company, some of those details. And this, I'm sure, is not going to be real easy to see, but on the left-hand side, we have Original Medicare. We've talked about A and B. With it, drug coverage is not part of Original Medicare. It's separate. You would want to consider that, or know that you may have a penalty later if you choose to wait. You also will have that decision about supplemental coverage. Do you want that or not? So that's kind of on one side. The other option that you would have would be a Medicare Advantage plan, and so that was the turning everything over to private insurance rather than sticking with the government. Most of those plans also have prescription drug coverage, so those would be the two decisions if you choose to go that route. Here in my area, I live in a fairly rural part of the state. We do not have very many options where I'm at. But it may be different where you are, so they may be something that would be a very good option for you there. Your Part A, your Part B, usually the Part D, all wrapped up into one plan. It's going to really look a lot more like what you've got as an employer plan, with everything all together and one calendar year deductible and so forth. You will have the deductibles and copays. You can't purchase a supplement plan to supplement the Advantage plan, so you will have those deductibles, the copays, the coinsurance. And I guess the thing, if you're interested in this and you do have some options in your area, unlike the supplement plans where you're comparing apples to apples, here every one of these plans is different. So I can sit here and I can talk to you about Medicare Part A and what it covers, and B and what it covers, and the supplement plans and what they cover, because they're all standardized by law. These Advantage plans are not. So you really do have to look at each one to see what do they cover, how do they cover it, how much am I going to pay, in addition to considering that premium. One of the advantages to an Advantage plan is that they do have an out-of-pocket max. Most of them around here have been around $6,700 for the last several years. So that would be the max that you would pay if something catastrophic happened. And sometimes they will have extra benefits, innovative benefits they call them, that are available. So you may be able to add vision or dental for an additional premium with that. Often anymore, with that increase of the age for full retirement benefits, I'll have many times people, who are working past 65 and have questions about whether or not they should stay with their employer coverage, whether they need to. They're worried about a penalty if they don't enroll in Medicare. As a general rule, you may be able to delay that enrollment in Part B, also Part D, also that supplement plan, if you or your spouse is actively employed and you're covered under that plan and Medicare is secondary. So Medicare is going to be secondary when you're turning 65 if the employer has more than 20 employees. That employer plan is going to be the primary plan. For somebody who's on Medicare because of disability, the employer has to have 100 or more employees. For most people, they're paying that monthly premium for Part B, so if they can delay that coverage and just continue on their employer group health plan, that works well for them. They can choose to enroll in Part A and B and use that as a supplement to their employer coverage if they want to. But if when they lose employer coverage, then there is a special enrollment period. So as long as you've had that employer coverage, there would be no penalty. You've got 8 months to enroll in Part B after you lose that coverage. There are 2 forms that would need to go to Social Security. One of them is telling Social Security when you want Part B to begin, if you've enrolled in A and are wanting to pick up Part B. The other form is going to tell Social Security, it's going to verify your employment, basically. If you're contributing to a health savings account, that is one time when you may not want to enroll in Part A. If you're not drawing Social Security, that may be an option, but that would be, you cannot be enrolled in Medicare and contribute to a health savings account. So wanted to make sure that people were aware of that. That would be a time when, if you're continuing to work, you have employer health coverage and you're wanting to continue to contribute to that HSA, you may want to delay. There is a 6-month look back on the enrollment on A, so you'll want to time that. Again, I'd suggest talking to somebody about that specific situation if you fall into that. Other retirement options, basically with any of these, if you do not enroll at 65 or when you lose that employer group health plan, if you're working beyond 65, having a retiree health plan, being on COBRA, having federal employee health benefits, having VA coverage, those do not give you a special enrollment period later. Federal employee health benefits, you're going to have an option to enroll in B or not, but just keep in mind that if you do not, you will have a penalty. You'll have to wait till the general enrollment period. You'll have a penalty for not being enrolled. Same with VA. If you think you're going to want to continue to get all your benefits through the VA and then choose later to enroll in Medicare, you'll have to wait until that general enrollment period. You'll have a penalty for not being enrolled. I've had some people who have thought they would always want to be enrolled in VA coverage, and then they've ended up with cancer, and they wanted to get cancer treatments locally instead of driving all the way to Wichita once a week and run into that problem. Well, you can't just enroll right now. That doesn't, just because you've been getting your coverage through the VA, that doesn't give you that special enrollment period like active employment would. I think we probably, I don't know whether anybody here, whether disability is an issue. If you're drawing Social Security disability benefits, you will be eligible for Medicare at that 25th month of benefits. To continue on an employer group health plan with that, it needs to have, the employer needs to have 100 or more employees. If they do, you can continue on that employer plan. You'll be able to pick up with a special enrollment period when you lose that coverage. Another thing to mention, I guess, with somebody who's on Medicare because of disability, when you turn 65, you have that initial open enrollment period. So, for example, if you didn't pick up a supplement plan at the time and you want to later, you will have kind of a do-over that most of us don't get. Health Insurance Marketplace, we didn't have anybody who was on that, so I won't say a lot about that other than, no special enrollment period later if you miss that 65 initial enrollment period. MyMedicare.gov is a website I wanted to mention. It's a place that you can go on and look at those benefits claim statements, Medicare summary notices they're called. You can look and see, have you met your deductible yet? You can look at a lot of information on that website. You'd create an account similar to creating one for the My Social Security website. And then one last thing I wanted to talk about here today is the fact that they're going to be replacing Social Security cards. They're the same law that is changing things to where they're not going to be able to sell the supplement plans that pay the Part B deductible. Also, they're going to remove the Social Security number off of the Medicare card, and start sending those cards out in April. It's going to take a year to send them out. There will be a transition period between when they start sending them out this next April and the end of December of 2019. They're suggesting, though, that when you get that new card, to shred the old one and start using the new one so you don't lose it. These are going to be a new identifier number that is in no way associated with you. And the main thing that they're wanting pointed out right now as we go into this is, if you are already drawing Medicare, if you have a parent who is enrolled in Medicare, make sure that their address is up to date with the Social Security Administration, so that card, when it's sent out, it gets to them. And also just be aware that I fully expect this to be a prime arena for fraud, but Medicare will not be calling to make sure that beneficiaries have received their cards and asking for them to verify it by giving out their number. And I really worry about that happening and people giving out that new number. I've got my contact information up here as a last slide, and people, if you've got questions, feel free to give me a call or to send me an email. I don't know what other questions might have come in.
I will kind of go through. So a lot of it was about the resource list. Just as an FYI, if you did get the resource list before this session, please go back to the website and get the new resource list. We were able to add the pages we were missing, not. Deb was referring back to what she had sent. We only posted page 1, so I apologize for that. That's why we had the little confusion. Oh. But we do have a question that came in. Okay, I'm sorry. Let me go in. We're going to answer some poll questions here, ask the audience to answer 4 questions for us, and then we'll come back because I do have some questions for you, Deb. So if you could please answer the 4 questions on your screen. I'll give you a few minutes to do that. We won't broadcast these to everybody else, just kind of how we did today, and then we'll go back to answer some of your questions here. All right, it looks like most everybody has been able to respond. Thank you very much for that. The question so with the complexity of making the proper Medicare decisions, what types of professionals can a person contact to obtain the proper advice? Oh, Deb, do you want to unmute?
I'm sorry, I muted because I was getting some feedback.
All right.
My first recommendation would be to contact a SHIP counselor if you have one near you, just simply because that information is going to be unbiased. You can also contact brokers, insurance salespeople, but they've got a product they're wanting to sell, and they've got commission that they may not always be giving you, I guess, the the information as far as what's going to be best for you. I would hope that they would, but I know that sometimes that doesn't always happen. So you also can call 1-800-MEDICARE if you've got questions, because they can advise and they can answer questions. Some of the people, some who answer the phone are better than others, so if you don't feel like the person really knows what they're talking about, just call back and see if you can get somebody else, I guess. But and generally in the states that have the programs, if there's the SHIP programs, if there's not somebody local to you, there should be like a statewide number that you can call and reach somebody who deals with this frequently. But hopefully there would be somebody local that you could maybe go meet with.
And Deb, did you provide that information for each of the states that are typically on this series? I know we saw somebody from Arkansas on here, so
well,
we probably wouldn't have that information.
What I did on the very first page of resources, which is probably the only thing that you had posted maybe first, number 2 where it says State Health Insurance Assistance Programs, there's a www.shiptacenter.org that if you type that into your browser, it should give you some an idea of how to find those people in your state. Or the other option you might do would be to just type in SHIP, S-H-I-P, and then the name of your state, and that should bring it up.
And I'll let you know, a lot of states do partner with Extension Service, so you may have an extension agent or a specialist in your state that can guide you to the right place as well, or answer questions. I know in North Dakota, we have quite a few agents that are trained to be SHIC counselors, which is here, and like Deb was saying, she's a trained counselor as well in her state. So, all right. I don't see any additional questions come in. I'll give it just another minute here. But just a reminder that our upcoming sessions next week is Slash Your Spending, so looking at your expenses and finding ways to reduce those costs. And then November 1st, we'll be back with budgeting.
Well, and I do apologize for losing connection there. I have no idea what happened, but all of a sudden it just told me internet connection lost, trying to retrying or whatever, and then I looked down and I had the little exclamation mark like I had no connection at all. So, and I'm sorry I didn't point out that there were more pages to go up in the resource list either. I know generally you just post the one page, but I thought with this there's so much information that there's no way everybody could write things down fast enough. And so tried to give you a little bit of additional information that would be helpful later.
Yep. And it looks like, yeah, like I said, we've got that all taken care of. And again, any questions, please contact myself or Joel. And if there are questions specifically for Deb, we can get those to her. Or if you need a little clarification as well. So thank you all for joining us today, and I hope you have a great rest of your afternoon.
Thank you all for joining.